Hello, thank you for watching this webinar on Achilles tendon pain. This information refers to an overload problem on the Achilles tendon, what used to be referred to as Achilles tendonitis, sometimes it's called Achilles tendinopathy, and there's a few other names like that, but most people tend to know it as Achilles tendonitis. This is not going into too much information about rupture to the Achilles tendon, but I will mention that later because it needs to be included. And it's been put together by the Swansea Bay University Health Board, a group of specialist physios working there, and those are Alison Hill, Andy Lewis, Anthony Byrne, John Challis and Tanya Francis, and also John Neathey and Martin Wright from the Podiatry department have also added to this. The aims of this webinar, we'll get through quite a bit of information in 20 minutes or so. It will be what is Achilles tendon pain, what are the causes and symptoms commonly, how do we diagnose the problem. I will mention about Achilles tendon rupture because that's really important not to leave out. I'll then go into some more information about special groups, so people with metabolic conditions, tendinopathy in runners, then generally how we go around treating Achilles tendon pain, the relevance of medication, pain medication specifically, the need for x-rays and scans, and finally some useful links. What is Achilles pain? We're talking now about the tendonitis, tendinopathy rather than the rupture. What tends to happen is that when an Achilles is loaded at a rate that's faster than its ability to recover from the load, you then end up with chronic changes in the tendon, and that leads to a thickening. You can see from the picture the ankle on the right is a normal Achilles tendon and the one on the left is significantly thickened. Because the Achilles that's been overloaded, again in this case the left hand one, it can't cope with what's being asked of it, so it increases its size to try and spread that force over a bigger area. Unfortunately it does that in a very rapid way, swelling quite thickly, and is associated with quite a lot of pain, particularly when the tendon is used. So looking at the anatomy then, the Achilles tendon is how the calf muscle attaches to the heel. When you tense your calf muscle, the calf muscle pulls on the Achilles, pulls on the heel, and you go up onto your tiptoes. So that's the important function there. It acts very much like a spring, so you can load it up with an energy. So if you hop, for example, you land on the front half of your foot, you load up a huge amount of energy in that Achilles tendon like a spring, and it will launch it back out again. And so much is like a spring that it's actually got a 90-degree twist in it. And that makes it a very effective tendon at loading up energy and releasing it very rapidly, which aids all explosive movements, sprints, sudden changes of direction, and catching yourself if you fall forward. A lot of these power movements, and it really is quite important for those. The causes of Achilles tendon pain. There are a number of different causes, but really if you break it down, it tends to be that Achilles tendon has been loaded at a rate that's faster than its recovery rate. There are two groups we usually see. There's the active group, sporty, runners, football players, things like that, and the sedentary or the relatively inactive group. In the sporty or active group then, an onset of Achilles tendon pain usually follows quite a sudden increase in activity or perhaps a training error. So this will typically be adding aggressive hill sprints or some speed work. Also it can be following a period of layoff, so if someone hasn't trained for a couple of months, they then go back and suddenly expect to carry on where they left off. Or these really aggressive training programs, sometimes couch to 5k programs, can be taken too aggressively, and again it's a problem for the Achilles that's not able to absorb that load. The other group tends to be the metabolic group. These are usually the more sedentary, less activity generally. For them the Achilles is usually a problem as it attaches to the heel bone right at the bottom there, and there can be the presence of what we call metabolic or hormonal causes, which I'll come to a little bit later on. Looking then at the symptoms of Achilles tendon pain, it's usually a fairly gradual onset. It could be over the course of a weekend, a week, or even several months. Usually though it does come very gradually. If you get a real sudden onset of pain, then there'll be a slide coming up to talk more about that. But on the whole, people tend to have their pain come on fairly gradually. They often report a sharp pain in the back of the ankle, aggravated usually by walking. It's often quite tight and sore when you first get out of the bed and walking downstairs, but it will often ease a little bit towards more into the morning. And anything a bit more rapid, so running will usually aggravate it. People often say walking uphill gives them more pain, but usually it will ease with a little bit of movement. And the symptoms of an Achilles tendon pain are fairly common. Most people will report these symptoms. But what it doesn't usually involve is the whole ankle. There's rarely any pins and needles associated with it, and it shouldn't give you any pain underneath the heel or in the foot. Achilles tendon pain is really localized to that Achilles tendon, and often if you reach down and pinch that Achilles tendon, that will reproduce the pain and be quite uncomfortable. To diagnose Achilles tendon pain is on the whole fairly easy. It can be diagnosed based on where the pain is felt, so it should be from the heel and up to sort of 6 or 8 centimeters above that. It shouldn't be further up the calf muscle. It certainly shouldn't be above the knee. So combining where the pain is felt and does it hurt when you squeeze the Achilles tendon gives us a lot of information and is a very reliable way to diagnose this problem. It also adds to the information if we know what makes your tendon pain worse and what eases it. That can be quite helpful too. And because on the whole these are quite easy to diagnose, X-rays and scans are very rarely needed at the start of the treatment process. As I've mentioned already, it's quite important to distinguish between Achilles tendon pain from overuse and an Achilles tendon rupture. As I've said, an overuse tendon problem comes fairly gradually, and that will be typical of the ankle picture on the bottom of the 2 pictures. An Achilles tendon rupture, on the other hand, is an incredibly sudden onset of pain and weakness. People often turn around to see who kicked them or threw a stone at them. It's very much a sudden pop which comes out of nowhere, and the above picture of the Achilles is what they tend to look like. So very swollen, they've lost that normal structure of the Achilles tendon. There's a lot of weakness reported by people, so the inability to go up on tiptoes. And if you think, if the calf muscle attaches to the heel through the Achilles tendon, if for whatever reason that's snapped or ruptured, when that calf muscle pulls, it just doesn't have any effect on the heel, so you don't lift up on tiptoes. I said the Achilles will look and feel very unusual. The reason I'm mentioning this now is an Achilles tendon rupture is unfortunately quite commonly missed or misdiagnosed. People sometimes are told that they've sprained their Achilles tendon. If you're in any doubt, so if you've had a really sudden onset of pain, the Achilles doesn't look the same, it doesn't feel the same, and you just feel like you haven't got any power in that Achilles, you must get that checked, either in a minor injuries unit or an A&E unit, and that really cannot be left and has to be checked. Moving then to metabolic conditions, as I mentioned, Achilles tendon pain really comes from an imbalance between load and recovery. In the sportier groups, it tends to be an increase in load. In the less sporty, and certainly those with metabolic conditions, it can actually be a decrease in recovery. So you get the same imbalance, but there's 2 ways to get it. The reason we're discussing that is some of the conditions listed there have been proven to have a negative impact on your ability to recover. So even if the load is completely unchanged and is fairly steady and sound, the presence of diabetes, obesity, menopausal hormones, particularly gout and inflammatory arthritis, can actually reduce your ability to recover from that tendon load. And the menopausal hormones, that's one of the common reasons we see Achilles pain and also pain on the side of the hip in women tend to be in their 50s. That leads fairly nicely then on to lifestyle changes. We do know that the force going through the Achilles tendon, the heavier you are, the bigger the force that tendon has to deal with. So a steady increase in weight can have a real negative effect on your Achilles tendon. And weight particularly, because there's more weight going through the tendon, and as was the other slide, the presence of diabetes and obesity can actually reduce the tendon's ability to recover. So you're overloading that Achilles in two ways. There's some really good advice on the NHS Live Well website. There's a link there for sensible and safe weight loss if required. It's also quite important to consider reducing or ideally stopping smoking altogether. The reasons for that is smoking has been shown to reduce the blood supply to soft tissues, which is a key part of their healing process. And again, another link there to the Live Well website. And ideally avoiding this boom and bust pattern. So doing a huge amount of work and then being in quite a lot of pain, so you have to rest up for several days. Then to catch up on all the things you should have done when you were in pain. When the pain settles, you overdo it. And this boom-bust pattern is quite common for these kind of problems and is a big part of dealing with chronic pain conditions. Next then, runners with Achilles tendon pain. This group deserves special mention, I think. It really is a common running injury. It's been estimated that at least 40% of runners will at some point suffer with Achilles tendinopathy, what used to be called Achilles tendonitis, and often it can be traced down to a training error. A number of examples, such as starting a training program too aggressively without enough rest period and without allowing your body to adapt to the new sport. It can be adding too much ballistic work, such as speed or hill work, or sand dune running, things like that. And often, if you're really honest with your training, you can trace back to quite a sudden change. It's quite a big area, talking about runners with Achilles pain. There's quite a lot of factors involved. One of the big things really is that you shouldn't try and force running through that Achilles tendon pain. You may be tempted just to run through it and run it off. The problem is if you're in pain in that Achilles, your calf and the Achilles won't be working as efficiently as it should. So when you run, you've got to get that power and that force from somewhere. So often then you put more pressure on the other Achilles tendon. So you get tendon problems in both sides. It can be pain underneath the heel, pain in the knee, or further up. So running through the pain is probably not a good idea. It also matters then, if you get no pain throughout the day, but only pain when you run, then I would advise you cut your running by about a half to start with, and keep cutting it by a half until you don't get that pain anymore. And then after a period, you can start to rebuild that. If you get pain just walking around, and worse pain when you run, you really shouldn't be running. And whether you're going to cross train on the bike or a rower or in the pool or something like that, that may be worth doing. Sometimes it's worth considering running technique, particularly if you're new to running, and speak to a coach in a running club, and they can often give you really good advice about that. For more information, because this is a huge topic, I'd really recommend Tom Boone's running physio website. There's a huge amount of really good evidence-based and research-based information on there, and I'd certainly recommend that to any runners who are picking up problems or pains anywhere. This next part on treating Achilles tendon pain is probably what you're most interested in. I'll go through a series of exercises that seem to be very helpful. A quick mention of footwear and insoles and the impact they may have. We've already spoken about lifestyle changes, and those three together tend to have a very good success rate, really help a lot of people. If they've been tried for a period of perhaps a couple of months and there's no real progress, then it's definitely worth getting in touch with a physiotherapist and a podiatrist for a bit more support and a bit more help. And I'll also mention about further treatment options if you've gone through all of that process and you're still having problems. Important exercises for us to help treat these Achilles tendon pains. The starting exercises are shown there. The top one is doing calf raises on both feet at the same time, and the second one is progressing onto a single leg heel raise. You may find if you're in a more sedentary group, perhaps with some metabolic problems, as I've discussed already, you may not be able to do a single leg heel raise, which is the bottom exercise. In this example, it's the left Achilles that's affected, so the person stood on the left side and is going up onto their tiptoes. We quite often see people who can't actually do that because of the pain and because of the weakness that's developed in the calf muscles. So for them, we start with a double leg calf raise, and as the picture shows there, just going up on the tiptoes, moving up and down fairly slowly. The numbers we're after is 8 to 15, 10 to 15, something like that, doing that 3 times in a row. So you do however many reps you can do. Quick break, repeat it, quick break, and repeat it again. If you can't do a single leg heel raise, you probably should be working on that, a good couple of times a day really, to try and build up some training volume. When you can progress past that and you can do a single leg heel raise, we're then looking for somewhere between 8 and 15 repetitions. Again, 3 sets of that. Working slowly, going from the floor up to tiptoes over the course of a few seconds and back down again. Again, if this is all you can do, if you can only do 3 sets of 10 or 15 single leg heel raises, I would suggest you probably do this quite often, twice a day, something like that, until you build the strength and develop the capacity to really push that on a little bit. Progressing on from the last set of exercises, if you've got to the stage where you can do 3 lots of 15 single leg heel raises, then it's probably time to start adding some weight. If you're quite active and they're not a challenge, it's probably okay to move on quite quickly to adding weight. There's 2 options shown here. If you've got access to gym equipment, then the top picture is a leg press. In this picture they're working on a right Achilles tendon problem, and if you know that equipment, that'll be familiar to you. Some people find it easier if they've got some equipment in the house, some dumbbells or kettlebell, or just putting some stuff in a rucksack, some books and things. You can add weight quite easily to this movement. In the bottom picture with the rucksack, they're working on their left Achilles tendon. You can see they're working on a step, so the heel drops below the level of the step and back up again. That's fine, that's a sensible progression, but I wouldn't encourage you to do that if the pain is as your tendon reaches the heel bone. If that's what we call an insertional Achilles tendon, this has got a potential to make that a little bit worse. So as from the last slides, do the same exercises from flat on the floor and going up. If your pain is more in the middle of the tendon, then doing it off the step is completely fine. It's quite important though, you load these things quite slowly, particularly in the early stage. So going from start to finish would take about 3 seconds. So if you're starting stood flat on the floor, it takes you 3 seconds to get up to a full tiptoe and 3 seconds back down again. What we're trying to do is avoid very rapid loading of those tendons, because that's got a habit of really annoying them and causing more pain. When we talk about using weight, 3 sets of 8 to 15 repetitions, that's a weight that you can't do 20 times, even if you wanted to. So you really work in that tendon quite hard. You need the rest in between those sets, and you also need more recovery time between exercise periods. So that shouldn't be done twice a day, probably better every other, possibly every 3rd day. But that's assuming you're really working a heavy load, nice and slow, 3 sets of somewhere between 8 and 15. Footwear and insoles. I certainly believe that footwear has a potential to really impact your Achilles tendon pain. If you imagine that lifting your heel up by approximately ½ an inch can take 1/3 of the load off the Achilles tendon, and lifting by a full inch can take over half the load off the Achilles tendon. If we know that your Achilles is struggling to recover, reducing the amount of work it has to do would sensibly help with your healing process. Now this should really be assessed by a podiatrist, and this really is their specialist field as well, assessing the foot and ankle and further up the knee and the hip if required, looking at the biomechanics, and if they feel necessary, issuing an insole. Some of those are customised, sometimes they don't need to be, and they just an off-the-shelf insole will be perfectly acceptable. So you can see there, the Orthoheel Sport, they're quite a good insole, and there are others about of course, and below them are what are often referred to as blue dot insoles. The blue dots can be picked up really cheaply, often from somewhere like Boots. Buy a pair, pop them in your shoes. They are a bit squishy, so they don't give a huge amount of support, but they are quite good for lifting that heel up a little bit. Talking about insoles for runners, if you are getting lower limb pain when you run, I certainly think it's worth you speaking to a podiatrist. When you talk about the loads involved, some runners will do about 500 steps per kilometre. We know that the strain that goes through the Achilles, I mentioned before, it's like a spring. When you run, you can have up to 10 or even greater times your body weight of strain going through that Achilles, and the cumulative effect then is huge. It's estimated that a 70 kilogram runner running a marathon, throughout the course of the marathon, will have to absorb something like 36 tons of impact. And if that impact is going in the wrong place, you can understand why that can give you overload problems. Because of the benefits of raising that heel up, if you do have an Achilles tendon problem, I discourage things like flip-flops and minimal shoes. Those minimal shoes like the Vibram 5 toes there, the black and green shoes. There are some benefits to wearing shoes like that for your training, but it needs to be built up gradually over the course of 3 to 6 months, sometimes longer, to really get the benefits. So assuming you've tried various other things, lifestyle changes, some exercises, and if you are still in pain, then physiotherapy and podiatry have got an awful lot to offer, especially if the previous options have been tried but haven't worked. A number of ways they can help. So they can give a thorough assessment just to make sure that we are actually treating what we think we're treating and we've got the right diagnosis. Checking the biomechanics, and what that means is how your foot and your leg hit the ground and do they move as they should do. Strengthening key muscles is a really important factor, particularly for runners. A weakness in the glute muscle, the bum muscle, has been linked to Achilles tendon pain in runners. So a thorough assessment, not just of the joints, but also of the muscle strength and flexibility, can give us a real focused individual idea of things we can really work on. And then sometimes it's helpful to have someone with that kind of experience just to guide you back through your return to activity and spot where the training areas may be, and just to help you get back as quick as reasonably with a low risk of re-injury. So then, in the relatively rare cases where people have been through the advice we've discussed, had a good period of treatment, including exercises that lasted probably at least 3 months, been under the care of a physio and a podiatrist, and they're still getting problems, we tend to move then on to something called shockwave therapy. So the two pictures you can see there on the left hand side, the black and blue device is a shockwave handpiece, and on the left of the two pictures you can see it being used on the Achilles mid portion, and on the right of the two pictures you can see it then being applied to what we call the insertion of the Achilles tendon. If after going through all the other treatment options and shockwave as well, you're still having problems, then a discussion can be had around some of the injection therapies, such as dry needling, high volumes. But these injections really shouldn't be taken lightly. And although it's tempting for some people just to skip all the stages before and go straight to things like PRP injections and shockwave therapy, the difficulty with that is you're often not addressing things like biomechanics, muscle flexibility, muscle weakness, and to just give shockwave and injection straight off, often the problem comes back because you haven't really addressed the cause of why you've got that problem in the first place. We're often asked about pain medication because Achilles tendon pain can be very uncomfortable and can limit your activity quite a lot. We'd suggest you discuss this with a pharmacist or a doctor. They're certainly the experts in this field. But remember that simple pain relief will only give you a short-term effect, and it's unlikely to completely get rid of all of your pain. There's a number of unwanted side effects from long-term analgesia, which are painkillers, and they're certainly not an alternative treatment. A far better long-term solution is to go through the things we've already discussed, any lifestyle changes that are required, not training through an Achilles tendon problem, and getting someone to examine for any imbalances in muscle strength, flexibility and your mechanics, and you'll get a far better lasting benefit from that. And as for the injection therapy, if you've got tight calf muscles, painkillers don't do anything for that. If you've got weaker bum muscles on one side and that's why you're overloading that tendon, there's no tablet that's going to correct that. Imaging refers to x-rays and scans, and for the Achilles tendinopathy, the Achilles tendon pain, it's rarely necessary. As I said before, it's quite easy to diagnose these problems. The exception would be then is if perhaps the diagnosis was a little unclear, the area of pain was larger than we'd expect for an Achilles, or what aggravates or eases the pain doesn't really fit the normal, then we may want to use some imaging just to be certain we're treating the right thing. Another time when we may want to scan is if after several months of really good quality treatment, that tendon hasn't improved and is still causing you pain, we may want to have a scan then, just to again confirm we've been treating the right thing and to plan the next stages of treatment. When we do imaging for the Achilles, it's usually the ultrasound scan we go for. It gives us a huge amount of detail, and we can also look at any unnecessary blood supply in the Achilles tendon. So X-rays and MRIs are really, on the whole, not that useful for these problems. An Achilles tendon rupture is very different, as I've said before, and that would need an urgent scan of some type, just to confirm the extent of the injury. But it's really common that people will be diagnosed with an Achilles tendon problem, have really good quality treatment, and completely get back to normal without ever having a scan. We've included here some useful links. The Swansea Bay Physiotherapy website is probably where you access this webinar from. There's a lot of information on there which I'm sure will be really helpful to you. I mentioned a few times of the benefit of podiatry in treating Achilles tendon problems, and you can self-refer to the Swansea Bay Podiatry department on that number. You can also self-refer to physiotherapy, and information for that is on the Swansea Bay website. 2 links there to the NHS Live Well pages, that's the weight loss and quitting smoking. I've mentioned it earlier in the running section. Tom Goom has got a fantastic website called The Running Physio, and there's a link there. I also mentioned early on about a video on tendon compression. It's about 5 minutes long, it's really well put together, and it explains the difference between a tendon that's under too much compression and why we may want to treat it in a certain way. So that's a good 5-minute video if you want to have a look at that. Thank you very much for listening to this webinar, and if you need any more information, please get in touch.